Hi, my name is Angelica Casado, and I am a dietetic intern and master's student at Benedictine University. Upon being given the opportunity to research a promising weight loss strategy and to assess its effectiveness in depth, I chose a high fiber diet. In order to understand what a high fiber diet consists of, we must first understand what fiber is and how it functions. Fiber is defined as the roughage of plant-based foods that helps keep the digestive system functioning at its optimal level. Fiber can be seen as a brush that scrubs the lining of the GI tract, helping to keep the digestive system clean. Fiber is either soluble and dissolves in water or insoluble and does not dissolve in water. Soluble fiber helps maintain blood sugar levels and reduce cholesterol, while insoluble fiber helps prevent constipation and increase fecal bulk. As stated on the previous slide, fiber is either soluble or insoluble. After it is ingested, soluble fiber absorbs water and transforms into a gel-like substance. This substance entraps foods like fats and cholesterol, carrying them through and eventually out of the digestive tract. Insoluble fiber passes through the digestive tract still intact and essentially works as a scrub brush, clearing debris and promoting regularity. This graphic from the National Fiber Council displays the mechanism by which fiber acts on the digestive system. Increasing fecal bulk, as fiber does, helps you feel full sooner. Additionally, fiber takes longer to digest than most other foods, which makes you feel fuller for a longer amount of time. Coincidentally, foods that are high in fiber, this being fruits, vegetables, and whole grains, are for the most part low calorie, meaning that you can eat a substantial amount without blowing all of your day's calories. This is why consuming a colorful, vegetable-packed salad will oftentimes keep you feeling fuller for a greater amount of time than a value meal from your favorite fast food restaurant will. Now, let's take a look at some studies that do a great job of assessing the effectiveness of fiber for weight loss and overall health. A study conducted in a group of 173 obese men and women from the United Kingdom aimed to compare a high fiber diet versus a low carbohydrate diet in treating obesity. The study participants were randomly assigned to either dietary group and followed the dietary pattern for 52 weeks. At the 16-week mark, the mean weight loss of the individuals in the high fiber group was 9 pounds and 11 pounds in the low carbohydrate group. Additionally, both total and LDL cholesterol levels decreased in the high fiber group versus no significant change in the low carbohydrate group. At the end of the 52-week trial, individuals of the low carbohydrate group were more likely to retain the weight they had lost when compared to the high fiber group. The study was successful in assessing the effectiveness of a popular treatment for obesity, the low-carb diet, and a more innovative strategy, that being a high-fiber diet. Unfortunately, the study did not clarify the exact grams of carbohydrate that the low-carb group was intended to consume, and the high-fiber group was instructed to increase fiber consumption specifically through beans and legumes. While these limitations are not major, addressing them are two ways in which the study could have been improved. A second study examined the effects of two calorie-restricted diets, the Mediterranean diet and the Central European diet, on both weight loss and metabolic health. The Mediterranean diet focused on a moderate fat consumption, while the Central European diet emphasized an increased intake of dietary fiber derived from complex carbohydrates such as oats, legumes, root and cruciferous vegetables, and stone fruits. Participants were randomly assigned to either of the two dietary groups and assessed every 4 weeks based on their weight, waist circumference, and blood pressure. Additionally, each individual completed a dietary assessment via a food log for 3 days every fourth week of the 16-week-long study. 139 of the 144 original study participants completed the 16-week-long dietary intervention. Upon final assessment, both groups lost weight, with individuals of the Central European diet group losing an average of 16.5 pounds and individuals in the Mediterranean diet group losing an average of 17 pounds. There were no profound differences in waist circumference, fat mass, visceral fat, blood glucose, and blood pressure between the two groups, as significant differences were identified in both groups. Participants of both groups saw a reduced risk in factors of metabolic syndrome. It was concluded that individuals more adherent to the diet they were prescribed, regardless of which group they were in, the, the more weight they were likely to lose. Individuals most adherent to the Central European diet lost significantly more visceral fat than participants of the other group. Unfortunately, the study failed to specify the difference in grams of fiber between the two groups, which would have been interesting to compare. One last and final study explored the effects of diets high in both fiber and dairy on weight loss in obese individuals. 90 obese adults between the ages of 25 and 70 were randomly assigned to one of the three following dietary groups. Group 1, a 500 calorie deficit with a macronutrient composition of 20% protein, 50% carbohydrate, and 30% fat. This diet provided average levels of both calcium and fiber as well. Group number 2, same diet as group number 1, but 4 servings of dairy were prescribed, while the first group were only prescribed 2. And group number 3, with the same diet as group number 2, but an increase of daily fiber consumption. Anthropometric measures, along with biochemical data, were gathered and assessed every 12 weeks for the duration of the 48-week-long study. Of the 90 participants, 72 subjects completed the entire duration of this study. The study showed substantial weight loss, about an average of 9% weight lost, in individuals of all groups, and concluded that neither an increase in dairy nor in fiber enhanced weight or fat loss. Additionally, between groups, there were no differences in body fat or trunk fat loss, waist circumference, or hip circumference. The study failed to determine whether or not weight and fat loss was a result of the calorie restriction alone, or if dairy and fiber consumption played a role. As no significant differences between the groups were identified, the study was consistent with other findings that protein, in this case from the dairy, and fiber may aid in satiety, but that a calorie deficit is the most efficient means of weight loss. Findings from the studies examined have shown that fiber may aid in weight loss through satiety and thus a calorie restriction. With that being said, a high fiber diet may have more benefits than just weight loss. The first study examined concluded that a low carbohydrate diet may be most effective for weight loss in obese patients, but that a high fiber diet resulted in remarkable reductions in total and LDL cholesterol levels. The second study concluded that a high fiber diet was beneficial in reducing an individual's risk for factors associated with metabolic syndrome, such as blood pressure, blood glucose, cholesterol, and visceral fat. The third and final study concluded that weight loss in individuals following a high fiber diet was achieved via a calorie deficit, hypothesized to be due to satiety associated with this diet. The effectiveness of a high fiber diet is highly dependent on how much fiber the individual is currently consuming. Someone that eats plant-based and chooses whole grains as opposed to refined grains may not see as much of a difference as an individual that frequently consumes fast food or refined grains. Fiber aids in digestion and pulls excess waste from the digestive tract, so your current diet will most likely influence the current functionality of your digestive tract and how much debris there is for the fiber to act on. Research has consistently shown that fiber aids in satiety, which may result in eating less, putting an individual in a calorie deficit. If this calorie deficit is large enough, this is ultimately the cause of the weight loss. While the focus of this presentation has been on weight loss, many of these existent studies showed an improvement in various laboratory tests often associated with obesity or metabolic syndrome, such as cholesterol and blood glucose levels. Upon reviewing 10 of the most recent studies regarding increasing fiber consumption for weight loss, no life-threatening safety concerns were identified. Additionally, while it is possible to consume too much fiber, it is highly improbable. Because fiber works to pull impurities and excess waste from the digestive tract, water is lost through defecation. In order to prevent both constipation and dehydration, it is important to increase water intake as you increase your fiber intake. 1 glass of water per every 5 additional grams of fiber consumed is the general recommendation. The RDA method for fluid intake is 1 milliliter per calorie consumed. The Mayo Clinic, along with most other guidelines, recommend that women consume 11.5 cups per day, while men consume 15.5 cups of water each day. This ensures adequate hydration, body temperature regulation, lubrication, and cushioning of joints, along with regular bowel movements. Ensuring adequate hydration while increasing fiber or maintaining a high fiber diet is key to proper digestion and fiber functionality. It is recommended that individuals consume 14 grams of fiber per every 1,000 calories they are consuming or 25 grams on a 2,000 calorie diet. This recommendation should equate to roughly 21 to 25 grams per day for women and about 30 to 38 grams per day for men, depending on age. With that being said, many individuals do not consume nearly as much fiber as the daily recommendation, with a majority of Americans consuming only about 15 grams per day. The implementation of a high-fiber diet into your life may be easier than you think. Fruits, vegetables, whole grains, nuts, seeds, and legumes are all high in fiber, with some containing more fiber than others. Implementing more of the following foods into your diet can help you achieve adequate fiber intake. Lentils with 15 grams per half cup, seeds like chia and hemp. Chia has 10 grams of fiber per 2 tablespoons, and hemp has 9 grams per 3 tablespoons. Pears with 6 grams of fiber per an entire medium fruit, and berries with 4 grams of fiber per half cup. While naturally occurring fiber, such as the type found in fruits, vegetables, legumes, and whole grains, is preferred, fiber-enriched breads and cereals are also a good option for those unable to achieve adequate fiber intake. It is important that fiber is increased gradually, as going from very little fiber consumption to the recommended 25 to 30 grams per day can result in GI issues, the most common being constipation. Gradually increasing fiber intake by following the tips listed on this slide is a sure way to reap the benefits of a high-fiber diet. Thank you for listening to this presentation on the effectiveness of a high-fiber diet for weight loss. Listed on this slide are the studies included in this presentation, along with websites that I use to gather more information, some of which you may be interested in for more information regarding fiber and weight loss.